Services presented by Indiana Family to Family. Indiana Family to Family is the parent-to-parent organization and family-to-family health information center for the state of Indiana. These centers are statewide, family-led organizations that assist families of children and youth with diverse health and mental health needs and the professionals who serve them. We provide information, education, training, support, and outreach. The information in this presentation is current as of November 2024. As with any resources or information, it is important to verify the information provided to ensure it meets the same needs as your situation. An effective primary care medical home results in better health outcomes. An essential part of the medical home model is treating the whole patient, including addressing issues with mental and behavioral health. It is important for families to express concerns about their child's mental and behavioral health needs and to actively advocate for screenings and services. This is particularly true when the child has a primary intellectual or developmental disability diagnosis. Often in these cases, family members and healthcare professionals alike attribute psychological and behavioral concerns to the primary diagnosis rather than considering an additional mental health diagnosis. Indiana is working to improve access to and quality of mental health services for Indiana youth and families through its systems of care model in hopes of improving the overall wellness of Hoosiers. Mental health clinics may be available to offer mental health services. You may visit the link on your screen and select your county to find one near you. An ombudsman can help you understand and use mental health services. To reach the ombudsman, call the number 1-800-555-6424, extension 1239, or visit the link on your screen. Schools are responsible for identifying students with mental and behavioral health challenges that interfere with learning. The parent or guardian may request educationally related mental health services, also known as ERMHS, in writing to see if the student qualifies for educationally related intensive counseling services, also known as ERICS. The Student Assistance Services teams coordinate the services. A student with a suspected or confirmed diagnosis may require a special education evaluation for an individualized education plan or a 504 plan. Community-based clinics may offer free or low-cost options for mental health services. Clinics may be offered by organizations such as faith-based organizations like Catholic Charities or university programs that have graduate students who provide treatment under the supervision of clinical faculty. Under the Early and Periodic Screening Diagnosis Treatment Benefit, also known as EPSDT, Medicaid provides comprehensive and preventative coverage, including mental health services for persons under 21. You will need to choose a doctor and health plan and seek care from providers within your plan. When using your private insurance, review the benefits and limitations which may vary by plan. Note that if insurance denied coverage, you have the right to appeal. The Mental Health Parity and Addiction Equity Act of 2008 requires that mental health benefits be no more restrictive than general medical benefits. The Affordable Care Act, which includes marketplace plans, requires that mental health be covered as an essential health benefit, including preventative services. Some children's benefits may be fully covered with no copay or coinsurance. Self-pay on an income-based or sliding scale is available at many clinics if the person seeking treatment does not have coverage options like Medicaid or private insurance. The Children's Mental Health Wraparound Services, also known as CMHW, is designed to offer a comprehensive, holistic, youth and family-centered way of responding when children or youth ages 6 to 17 experience serious mental health or behavioral challenges that interfere with daily life. CMHW provides intensive home and community-based wraparound services. Care strategies include, but are not limited to, behavioral health and support services, crisis planning and intervention, parent coaching and education, and community resources and supports. Services available include wraparound facilitation, habilitation, respite care, family support, and training for the unpaid caregiver. The Children's Mental Health Initiative, also known as CMHI, is designed for children who meet the diagnostic criteria for CMHW but do not have Medicaid coverage or have an exclusionary diagnosis. Both CMHW and CMHI are voluntary services, and caregivers must be engaged. To apply for wraparound services, call 211 or visit the link on your screen. The application screening will direct the child to the program that is right for them. Money Follows the Person Psychiatric Residential Treatment Facilities Services Program provides funding for managing home and community-based supports for persons moving from qualified institutions to the community to ensure a safe and satisfactory return to the community. Not every youth in a facility or discharged from a facility will qualify. This is a voluntary program, and a person must meet a variety of eligibility criteria to qualify. For more information, please contact the Indiana Division of Aging at 888-673-0002. Each community mental health center operates a 24-hour crisis line, and no one will be denied services for the inability to pay. It is important to note that state psychiatric hospitals or state-operated facilities, also known as SOS, may only be accessed through the Community Mental Health Center. These state-operated facilities are inpatient units for persons in need of intensive treatment following screening by a community hub mental health center. These centers also provide case management services to facilitate transition from the hospital back to the community. Admission cannot be denied due to a lack of ability to pay. In addition, there are inpatient units for short-term acute care that may be accessed. There are multiple hotlines available to assist individuals who are in crisis. If you or a loved one is experiencing a mental health emergency, call 911 or go to the nearest emergency room. The 988 Suicide and Crisis Lifeline is a direct connection to specialists who are trained in suicide prevention and crisis prevention. Service is free and confidential. You can call or text 988 to access the helpline. The Trevor Project also has support 24/7 for LGBTQ+ individuals. You can call 866-488-7386 or text the word START to 678-678. They also have chat options available on their website, which is listed on your screen. The SAMHSA National Helpline is available 24/7. You can call 800-662-HELP or visit the link on your screen to connect with a representative for a live chat. The Crisis Text Line allows you to connect with a crisis counselor for free 24/7. Just text the word HOME to 741-741 to get started. Indiana also provides a suicide prevention resource locator. Visit the link on your screen or call 800-273-TALK for more information. If you have questions or concerns about your mental health treatment services, your rights and/or policies and procedures, you can call the Indiana Department of Mental Health and Addiction Consumer Service Line at 800-901-1133. For additional information and resources, you can contact Mental Health America America of Indiana at 317-638-3501 or visit the link on your screen, or the National Alliance on Mental Health, which can be found at www.nami.org. All links mentioned in this video can also be found in this video description. For more information or to receive peer-to-peer support, you can contact Indiana Family to Family at 844-323-4636 or at info@inf2f.org.